Hi, I'm Jessica Snyder, registered dietitian and outpatient nutrition director. Welcome to your first week after surgery, post-operative pre-select diet class. Our agenda today is to discuss your questions and concerns, really bringing in the full picture of if your experiences are normal. We want to bring this all together so that you know how to effectively use your tool. We need to address what you'll be eating and drinking during the pre-select phase and what your food choices are. We'll also be discussing supplements, exercise, wound care, medications, expectations and warning signs, as well as upcoming events. It's important we discuss your diet and lifestyle after surgery. Following a precise diet progression after surgery is an important piece to ensure proper healing. There's a modified texture of this diet during this process to help decrease inflammation during the post-surgical process. Liquids move through rather easily, and soft foods do as well. However, staying away from solid foods or foods that are coarse in nature or stringy during this time frame. Your portion size may be based on your tool after surgery. For bypass, that's typically about 1 to 2 ounces at this point. For a sleeve, it's between 2 to 3 ounces, and for a duodenal switch, between 2 to 4 ounces. Your food should be measured in a measuring cup during this time frame to ensure accuracy. During this presentation today, we'll be addressing your pouch as your new stomach and your remnant as your old stomach, and this is for bypass procedures only. So once again, listen to your pouch, and your volumes may be dependent on the surgical procedure you chose and the healing process. Dumping syndrome occurs for gastric bypass patients when they consume too many carbohydrates at a meal. This causes food to rapidly empty into their small intestines, causing symptoms such as diarrhea, sweatiness, dizziness, lightheadedness, fainting, nausea, or vomiting. So be cautious about the carbohydrates you're consuming and make sure you're focusing on protein. Your pre-select food choices will start on day 7, and these foods are typically tolerated for bypasses at 1 ounce every 2 hours, and for a sleeve or duodenal switch at 1 to 2 ounces every 2 hours. Small, frequent, protein-rich meals is our focus during this time frame, and your pre-select diet will be from day 7 to day 21. The pre-select diet foods include things such as low-carb yogurt, low-fat refried beans, egg whites or egg beaters, fat-free cottage cheese, as well as sugar-free pudding and tofu. These are appropriate during this pre-select diet phase from day 7 to day 21. Protein shakes and powders can be continued during this phase to help you meet your protein goals. Protein drinks are used to help supplement your nutrient needs. You can consume between 1 to 8 ounces of protein drinks every 2 hours. It's important that you keep track of a food log to help ensure you're meeting your protein needs throughout the day. Additional protein powder can be used in soft foods that you're consuming. This can help enhance the protein quality of the food you're eating and better help you to meet your protein needs throughout the day. The #1 reason for readmission into the hospital is dehydration. So sip, sip, sip throughout the day and stay hydrated. This may feel like a full-time job, but getting a minimum of 48 ounces of fluid per day and a goal of 64 should feel like something that you're working towards. Also, avoiding any straws, carbonation, caffeinated beverages, as well as calorie beverages during this phase. Water is your best choice during this phase, and making sure you stay on top of fluids, but you do not need to separate your meals from your fluids at this point. That doesn't begin until 6 weeks. Vitamin supplementation is a lifelong requirement to prevent deficiencies. Your food path has been rerouted and absorption has been decreased, as well as you're not eating as much food as you once did. So supplementation is crucially important.
Yep.
Liquid and chewable options are your best form of multivitamin supplementation. You can talk with your doctor about switching to a pill-sized tablet after about 3 to 6 months. You'll just want to make sure that they're smaller than the size of a pea to avoid them getting stuck. And you may, at that point, address if you can cut your pills with a knife cutter and absorb them appropriately. Once again, talk to your doctor if this is a modification you want to address. Taking a multivitamin after surgery is something that you've already started. You will need to make sure you're maintaining that regimen of taking 2 doses per day depending on the surgical procedure you've had. For B12, it needs to be taken at 1,000 micrograms per day, sublingually, which means under your tongue and melting completely, or that nasal spray, or the once-a-month injections with your physician's office. Additional vitamins and minerals may be recommended based off of your labs, and doses may be changed based off of your lab values. So work with your dietitian and doctor to make sure you're up to date with the appropriate vitamins and minerals you should be taking. Calcium and fiber supplementation does not start until 6 weeks or the solid food plan, so you can hold on that for now. This is your vitamin and mineral chart. So review your current supplementation and the timeline in which you should be progressing these vitamins. At this point, you should be at minimum taking your multivitamin as well as your B12. And for the duodenal switch patients, making sure you take your fat-soluble vitamins A, D, E, and K. Exercise is as important as water and protein, and it must be used together to ensure success. It helps with healing and promotes circulation, it improves your mood and energy, increases your metabolism, and is a part of your lifestyle change. So start a routine today if you haven't already. You should be walking 4 to 6 times a week at first and working on increasing that over time. Work towards getting 30 minutes a day, and you can split it up if needed. Set obtainable goals and start working on progressing towards those goals throughout the day. You may get fatigued, but remember, you can break up your activity. Still, no heavy lifting such as pushing or pulling or straining. No more than 15 pounds at this point. So focus on activities you can do instead of the ones you can't. In regards to your wound care, if your incisions are oozing, you can dress and gauze those with paper tape. Change the dressings daily. Daily checks for incisional infection are important. So make sure you're taking care of your incision and assessing how they're healing. No soaking in baths, as that does increase the risk of infection. You should be waiting at least 3 to 4 weeks for wounds to heal before you start soaking in a bath, swimming, or going in a hot tub. Although baths and bathing are not appropriate, showering is always okay. After surgery, we want to make sure that you have your follow-up appointment scheduled with your primary care physician. This should be completed within 1 to 2 weeks of your surgery, especially if there's medication changes that are needed. Many of our patients experience medication changes due to their change in blood pressure, blood sugar, as well as other challenges they may be having that need medication adjustments. A small amount of weight loss can make a big difference in these medication changes. Monitor your blood sugars frequently if you're diabetic, as well as monitor your blood pressure daily if you have blood pressure challenges such as hypertension. We want to set you up for success with your expectations. Many of our patients will ask, are these aches and pains normal? It is more common to have left-sided abdominal pain, as there was a lot of manipulation during the surgical process on this side of your body. Make sure your pain is not accompanied by unexplained nausea, vomiting, a fever greater than 101, unresolved diarrhea, or constipation. If these concerns are happening, please reach out to your surgeon. Mild nausea can be a normal symptom of your recovery and healing process. Make sure when you're eating that you're not overfilling your pouch. Also, make sure that you're staying on top of your fluid requirements as well as your protein goals. This will help to reduce hunger and improve your overall energy and healing as well as recovery. Your bowel habits may change after surgery, and it's normal to experience these changes. Looser stools are common on the liquid diet. Less frequent stools are also common as you're eating less food and less fiber. You will be adding fiber back in at the 6-week post-op phase. If you're having diarrhea, it can increase your risk of dehydration. If your urine is dark and you're starting to feel tired and dizzy, you may need to have an IV placed to get your hydration back up to par. So stay on top of your hydration, and if you're unable to do so, please reach out to your surgeon's office. Constipation is also something that some of our patients struggle with. If you've had no bowel movement for 3 days, please reach out to your surgeon's office as they may prescribe a stool softener. Minor symptoms require a call to your surgeon's office, especially if symptoms persist. A fever less than 101, a seroma, which is that blister-like appearance around your incision, temporary numbness in extremities, incisional abscess along your suture lines, fluid retention, loose knot or suture, constipation or diarrhea, mild nausea, or an oral yeast infection can be minor symptoms after surgery. Once again, reach out to your surgeon's office if these persist. Major symptoms that require a 911 call, emergency room visit, as well as a call to your surgeon include fever greater than 101, leg pain or swelling, shortness of breath, severe nausea with protracted vomiting, dizziness, as well as chest pain. Our upcoming events include our soft food class, which is at 3 weeks, our solid food class at 6 weeks, the 3 and 6 month office visits that you'll need to schedule with labs, the 6 to 9 month back to basics review class, and our monthly support groups for all of our patients, including bypass, band, duodenal switch, and sleeve.